Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar K. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, today we will discuss about a very simple principle of Ayurveda. So what is that principle? Very simple principle that everybody knows that there are three types of treatment has been told in Ayurveda. Daiva Vapashriya Chikitsa, Yukti Vapashriya Chikitsa and Sattva Vajaya Chikitsa. Now what the science says, Shastra says is that our treatment should contain all these three things. Now we know that Daiva Vapashriya Chikitsa is also called as Adravya Bhuta Chikitsa. That means there is no use of any drugs. Sattva Vajaya Chikitsa is also basically a Adravya Bhuta Chikitsa. There is no use of the drugs. But Yukti Vyapashriya Chikitsa is one of the Chikitsa where actually we are prescribing some of the Kwatas, Kashayas, Vatis, etc. But when Ayurveda says that for every disease, you have to do the treatment on these three bases. It is not merely the tablets or kashayas which are doing the work or correcting the body pathology. Rather, this Daiva Vapashriya Chikitsa and Sattva Vajaya Chikitsa is equally important and maybe the most important. Let us understand what is the concept, because there are so many medical pathis are there nowadays. Medical science, different types of medical sciences are there, starting from contemporary science and many other sciences. So how our Ayurveda is different from the other medical sciences is being in this case. Because Ayurveda always says you should not treat the disease and you have to always treat the Purusha. Therefore Ayurveda proposes the theory of Chikitsa Purusha or Karma Purusha. You are doing the karma in a Purusha, not on a body, not on a disease. Got the point? Now, Purusha means this whole body. This is the integration of this body, physical body, and as well as the psychological aspects. Atma, Mana, Indriya, and Panchamahabhuta body. This whole combination is called as Purusha. And treatment should be always given to Purusha first, not to the body and not to the disease. That means the treatment should be first given to the spiritual or psychological elements like Mana, Atma and Indriya. Now the first treatment principle which is mentioned is Daiva Vapashriya Chikitsa. It includes many things. It includes Homa, Havana, Swasti Vachana, Mangala Vachana, Puja, etc. Now, what is the importance of this Daiva Vapashriya Chikitsa? It is Adravya Bhuta Chikitsa. But before starting the drug treatment, you have to go for this Daiva Vapashriya Chikitsa. Daiva Vapashriya Chikitsa is nothing but it is a faith creating therapy. Now, before starting the treatment, you have to create faith in the person. That may be faith with the God, faith may be the doctor, faith may be the surrounding, or faith with this particular spiritual power or whatever may be. What is the idea behind this is when you are able to create a faith, it's also called as faith therapy. So faith, Vishwas. So that shift your mind into a positive mode. Now when you don't have the faith, everything is waste, isn't it? Suppose I have got faith with my parents. Yes, parents are great for me. If I don't have the faith, nothing. If I have got faith with the God, yes, it is a matter of great matter for me. Otherwise, there is no value as far as regarding God and all. So faith with the person, faith with the known person, unknown person or invisible entity, that is very important to create a positive mode of the mind. Once you are put into a positive mode, then the treatment is very easy. So you have to create this particular platform upon which you are doing the drug therapy. Okay, so if a patient is not having faith with the doctor, whatever treatment you give, definitely it will not going to work. Suppose if he has got the faith, yes, definitely it will going to work. So as a general, that means in the general practice, everybody would have been experienced this. It's all faith which is working. What is that faith? You are playing with the psyche of the person. When the psyche of the person was kept in a positive mode, then everything will be fine. So what Ayurveda says is, first correct his faith. So what are the different methods? Maybe some of the religious methods, maybe some of the non-religious methods, whatever may be, but create the faith in the action what we are going to do. So this is usually done by Homa, some of the religious activities, Havana, Swasti Vachana, Mangalacharana, telling the good things, wishing blessings of the Brahmana, Guru and the expert person or learned person or the old aged person. So these are all the factors which keep the body in a positive mode. So once you are set with this particular stage, then you go for the drug treatment. Now the drug will act better because Ayurveda again believe in the same. The drug which is given will not going to work on the body first, it will going to work on the mind first. On the mind first. Okay, so once the mind is very clear, the channels are very clear, okay, the thought process is very clear, okay, he is always having a positive thought process, then the drugs also better work. Therefore, the second line of treatment is Yukti Vyapashraya Chikitsa. It should not be done before doing Daivyapashraya Chikitsa. If you do it, Yukti Vyapashraya, if it is done without Daivyapashraya Chikitsa, it may give the partial effect, but it will not impart the complete effects. The third one is again Sattva Vajaya Chikitsa. Sattva means the mind again. Now again the mind is very important. Okay. Now Sattva Vajayam Punam Ahitebhyo Arthebhyo Manonigraha. Ahitebhyo Arthebhyo Manonigraha. Now actually this is controlling the mind from Ahita, Ahitebhyo Arthebhyo, Ahita Arthas. Okay. So that means the things which are bad, things which are not conducive for your body, things which are not conducive for this particular disease process, so that should be forcefully controlled. Suppose a patient of bronchial asthma, if he is continuously exposing to the particular triggering factors and he is not able to control his mind from that particular triggering factors, then the treatment is useless. Okay, so patient of Ajirna is again taking the Agni Mandya things, that means Agni reducing substances, and he is not able to control his mind from not eating those substances, again the treatment is waste. So this particular Sattva Vajaya Chikitsa is Ahitebhyo Arthebhyo Manonigraha. Okay, so you can say this particular Sattva Vajaya Chikitsa is nothing but this is a Patya of the Manas, just like when we say in the Ahara we talk about Patya. Okay, Patya and Apatyas. For this particular disease, this particular patya has to be taken, this particular apatya should not be taken. Similarly, this is also a patya and apatya for the controlling of the manas. Okay, which should not be thought of, which should be thought. Good things has to be thought, and the bad things or disturbing things should not be thought of. So when you follow this particular treatment protocol, this is the perfect treatment protocol of Ayurveda disease. Yukti Vyapashraya Chikitsa comes in the middle. Now, Daivyapashraya and Sattva Vajaya Chikitsa can be implemented in the beginning, followed by Yukti Vyapashraya, or Daivyapashraya you do first, then go for Yukti Vyapashraya and then go for Sattva Vajaya. So, any order can be followed. But Yukti Vyapashraya should not be done in the beginning itself, because we are not creating that particular platform for the better action of the drugs. Better action of the drug is possible once you create a very conducive platform for the treatment of the disease. So this is a very unique principle of Ayurveda. Okay, so it is quite useless if you give the drug treatment without preparing the patient. Preparing the patient in the sense, create the faith, create the confidence, create the cooperation, and then ask him or teach him how to control his manas. Okay, correct its thought process, create a positivity, and then go for the drug treatment. So this is exactly what Ayurveda says, and also the ultimate truth. Thank you very much.